Today, this is the first in one of the many episodes we're going to be doing called Real Patients, Real Stories. And we're starting today with Riley O'Donnell, who has PCOS. And we get a lot of calls in the office about PCOS, a lot of patients struggling. A lot of them have a hard time getting diagnosed. A lot of them aren't really taken seriously by medical professionals. So we feel like this is an important topic to get out there and address today.
I agree completely. It's underdiagnosed. It's not like it's getting any more common, although that may be the case, but really it's a question of patient and physician awareness of this very significant problem, and that adversely affects young women and actually throughout their lives. And it's really good that we have the opportunity to discuss it in more detail. So thanks, Riley, for being part of the solution and not part of the problem.
To be here.
Yes, and welcome to the Vagina Doctor podcast.
Oh, that too. Yes.
Thanks.
So I think it's important to share your story. I mean, because I've known you your whole life because you are my niece, but I didn't realize that any of this stuff was going on with you in your teen years. So let's start with when this all started, or when you recognized maybe there was something.
Yeah, I feel like there's maybe two sections of me figuring out there was something. It was like my teen years, like you said, I had really heavy periods. I had a really hard time finding a birth control that worked. I went through like half a dozen different pills, had all sorts of annoying side effects, etc. And eventually just was like, okay, well, I guess this is just my life. Like maybe that's just what being on birth control is. And then I don't know, you guys tell me, maybe a couple years ago, I started to feel really bad. And I texted you, Karen, to be like, I want to get my hormones checked. Like something feels wrong. I feel really low. I'm like not getting joy from working out. I feel nauseous all the time. My libido's low. I'm having headaches all the time. I was breaking out like on my chest and on my shoulders, places I've never had before, and felt like something was not right. So that's kind of, I feel like, when all this started.
Yeah, and I even think if you look at you, where you have resources at your fingertips, right? You have Duncan, a phone call away.
Mm-hmm.
Look at the time it took to really figure this out,
Mm-hmm.
right? Because
Yeah.
we went through quite, many conversations with you, different testing, digging, more testing, testing on certain days, you coming off a pill, you going back
Yep.
on a pill.
Mm-hmm.
And
No, I know.
such conflicting information coming through too, that we really couldn't put our finger on it initially. There were some of the signs of PCOS initially, but it wasn't really consistent. And so coming off the pill was to an extent illuminating because, well, first of all, the pill didn't solve the problem. And although
Right.
that is the most frequently used remedy for this nationally, probably internationally, it just didn't fit really well. And there were times of hypoglycemia and then sweating as though maybe there was ovarian, not quite ovarian failure, but at least dysfunction of the ovaries. And it wasn't until we did some specific tests looking at the androgen levels in the blood and glucose tolerance tests and insulin sensitivity tests and so on that we finally and actually talked to some of the leading investigators on the planet about this. I mean, we were involving the
Diana
one of
Schwartzbein.
Diana Schwartzbein, sure, Dan Richlick,
Mm-hmm.
and a colleague of his from University of Chicago. I mean, we were beating the bushes trying to find an answer here. And in fact, if we took bits of opinions from each of these people, we ultimately put it together. But nobody really said, "Oh, this is PCOS."
Mm-hmm.
But we did finally get to that point and recognizing insulin resistance and these changes with the ovaries. So it's been a long journey. And as Karen, as you say, Riley had access to this stuff. I mean, most people can't just call a friend who calls a professor in Chicago and
Yeah.
gets an opinion that would have taken months to get otherwise.
Yeah.
So
But it
I,
was funny because then we're kind of like faced with people asking us these questions. Like Riley, I had to like say, no, she doesn't have an eating disorder.
right. Oh
Right.
yeah,
I
that
remember
was,
that. Yeah. When
Yeah.
they were wondering if I was like secretly on Ozempic and like not
that's right.
telling you guys or something. And I was like,
Yeah.
Yeah.
no.
Yeah.
Or when the blood sugar tests I got, remember, I think it was like the labs were almost implying I didn't even drink the glucose. Like it was so hard to interpret what was
Yeah.
really happening that we just couldn't figure it out.
Oh,
And I know I'm so lucky because I can just text you guys and be like, hey, and you just like trust me. And I don't know, we're so lucky, and it's still this difficult to piece it together.
well,
Yeah.
then it doesn't happen when the lab does the wrong tests or
Then
only
that
does
happened
half
too.
of the tests. And I mean, it wasn't a smooth path by any means.
So what's interesting to me is we had to look at all these different things. I never had any idea that blood sugar, the different types of PCOS. So there's one that's attached to blood sugar. There's one
Mhm.
that's attached to just ovarian, pop in here, jump in here and finish my sentence because I'm going to get it wrong for sure.
Ovarian dysfunction,
Right. And so how
fertility.
how
Yeah.
do we how do we how I mean, I think Riley, you first, or not first, but maybe secondly, wanted to come in and check your fertility, right?
Yeah. Well, yeah. So I had wanted to have my fertility checked. And then I think that all kind of happened at the same time for me. Like I was getting married. I wanted to have my fertility checked just for my own sanity. And at the same time, had started to really not feel well for like maybe 6 months before that. And so I just was like, something doesn't feel right. And I remember one of the most like validating things I've ever gotten from a doctor was when I said everything to Duncan, and you all like immediately, Duncan, you were like, you're on birth control. Those things shouldn't be happening. And it was like, so I don't know. I just have never, I feel like I've always been told like, oh, you're on birth control. So you could have all these random symptoms and that's just your life. And instead you were like, no, you're on birth control to eliminate all the things you're describing to me. Like this shouldn't be what you're experiencing.
Yeah.
We need you to come off and we need to start this process. Like something doesn't sound right. And it was so validating because so much of this was just a feeling. Like I just felt like something was wrong. I felt like I
Hmm.
wasn't myself and I couldn't really put my finger on it. I was just like, please understand me. I don't feel like myself and I don't know how else to describe this. And you guys both were like, okay, we believe you. And I just really appreciate that. But yeah, I also did want to have my fertility checked in
And
the midst of all of this
yeah,
too.
and in doing that, we uncovered another piece to the puzzle that pointed to PCOS. And
Mm-hmm.
Duncan, I'm going to have you speak to that. Her something was high, and
The androgens were high.
the
Mm-hmm.
androgens were
The
high,
the male tendency hormones were high, and that
which
was
means
why you were getting the acne on your shoulders and back,
yeah,
Mm-hmm.
chest. PCOS used to be called Stein-Leventhal syndrome, and it was put together. A syndrome is a condition where there are varying types of symptoms, some or all of which people can experience. And with Stein-Leventhal, they put this syndrome together of the symptoms that they listed were irregular bleeding, menstrual bleeding, obesity, hirsutism,
which is
and
what?
being hairy.
Okay.
And in fact, those don't fit most people with PCOS. So it did get renamed like 30, 40 years ago to polycystic ovary syndrome. The condition didn't change, but our knowledge of it actually didn't change very much either because we weren't very good at recognizing it. And actually, to give a little bit of defense on part of my fellow physicians, it took us a long time to get to where we are in this discussion. Most physicians don't have the and patients don't have the opportunity to look so hard into this problem and to put so much time into it. We were fortunate to be able to have these excuse me, abilities at our fingertips, essentially, to investigate this further. And even then, there's still lots of unknowns as where do you go from here? Because polycystic ovary syndrome is associated with abnormal glucose metabolism, insulin resistance, and infertility.
Right. And I think that I didn't know that. And I've been through my share of stuff, but I didn't realize that PCOS was sort of like a lifelong thing.
Mm-hmm.
And what you're going to have to do in your life, like right now, you don't want to get pregnant. And I want to go through that part of it because I think when we were checking your fertility, there was like, oh, yeah, it was like this looks good, but you may have to do A, B, and C to get pregnant.
You might need some assisted
Yeah.
reproductive technology.
Yes.
Yeah. Mm-hmm.
So, and I know for you, that was a big worry. You wanted to make sure you could have kids because you're in graduate school now and you definitely want kids, but not this second. So you had to come off the pill, right? Right now, you're off the pill.
I am off the pill. Yeah.
But feeling better.
I'm feeling way better.
And you're on metformin.
Yep, I'm on metformin. I went off the pill so we could start all this testing. And because to get my hormones checked, I needed to be hormone free. And then I went on a different pill over the summer in efforts because to Duncan's point, a lot of doctors are like, this is the solve. So I tried that, had a really hard time and really didn't feel well. It didn't fix the symptoms at all. And it actually just added a few new ones. So I went off. I tried the Nuva ring and I was like so depressed on the Nuva ring. Actually, it was a really low, like several weeks for me. And I went off that and I've been off birth control since. And I
How
feel
long has that
way
been?
better.
How long has that been?
Since November.
So the only medication you're on right now is metformin.
Yep,
Right.
I started that in December. I think I took a month in between. We did another test or two, I think, and in that time. And then I started metformin right when we were done with all the blood work. And I've been on it ever since, and I feel normal.
And what does metformin do to a patient like Riley with labs like Riley? What's happening here?
It's a medication that is used for diabetes.
Mm-hmm.
And it works for that by decreasing insulin resistance. Well, that's still, a long way away from what we thought of as being PCOS.
Right.
But what we did know with I don't know, a lot of drugs, medications, you just don't know how they get to the point of being tried for something. And how metformin was tried to treat PCOS is beyond me. I mean, the guys were either lucky or brilliant, and I'll say that they were brilliant. And so with PCOS, for the up until a few years ago, for about 40 years, maybe even 50 prior to that time, people with PCOS were treated in one of two ways. They were either put on the birth control pill if they didn't want to get pregnant, and that would take away the irregular bleeding, even though the patients were feeling pretty bad. The fact that they weren't getting pregnant and they weren't having irregular bleeding was the best that we could get out of it. The alternative treatment was to treat them with metformin, which somehow started the ovaries ovulating again and producing eggs. And it did this, that we know now, by decreasing insulin resistance, and this connection between insulin resistance, diabetes, and PCOS is just, it's sort of almost in the realms of witchcraft. I don't know what's going on with it. But those are the two choices. And one of those works for Riley right now, although she doesn't want to get pregnant yet.
Right.
But she feels better on it, which means that things are functioning normally.
Yeah.
And you have to take other precautions.
What do you feel? What do you feel on metformin?
I just feel normal.
You do?
Yeah.
Well,
I just don't. I
Yeah.
just don't feel all the things I was feeling before, honestly. Like when I first started it, I was a little sleepy and like had a little bloating and just like general, like I don't know, the kind of
Yeah.
stereotypical side effects of starting something. But those went away pretty quickly. And now, I mean, I feel normal. Things, I think what's really happened is that, not to sound like too about the whole thing, but I feel very in touch with my cycle now. So
Okay.
Yeah.
I'm able to connect like, oh, I'm feeling a little moody right now. It's not out of control. I still feel like myself, and oh, I'm going to get my period in a few days. My cycle's regular. I'm having a full cycle. I can just connect dots. And so for me that alone has been really validating. So if I do have some symptoms or a little irritability or fatigue, I can look at my period tracker, see what day of the month it is, and be like, that makes sense. So everything that's happening to me, that when it does happen, it feels very in line with what is going on with that time of my cycle. And then that helps me just not totally spiral from it because I'm like, oh, okay, this is normal. I'm going through the full 28-day cycle. I'm ovulating, I'm having a period, I'm like doing the whole thing, I think. And it all
Yeah.
feels pretty normal.
Right. Because your periods were, I think, a little long before
They were long and
cycles
irregular. I didn't
and
really
irregular.
know, I often didn't know
Right.
when they were coming. I couldn't really tie certain symptoms. It felt like there was always something different happening. And now, the last couple of months, it's felt very consistent. So even in those moments of having symptomatic weeks, I'm able to be like, oh, yeah, I'm like a little extra teary this week because I'm PMSing. This is what everyone's been talking about for 2 decades. And I had never really experienced this kind of consistency. Like, oh,
Right.
like that's what this means.
Yeah.
And I just, yeah, that's all brand new for me.
That's great. And then what about the other symptoms that you had, like your skin? Are you feeling other things are getting better on the metformin?
Yeah, my skin's totally fine. I haven't had any significant, I mean, it's just the same, I guess. Like I've always had a little, but always like on my face, nothing, different parts of my body. I feel much more like in control, I guess. Like I feel like myself. So that sort of
Hmm.
out of control or like rageful feeling, I haven't had that in months.
Okay, that's good.
I most significantly, I was having what my doctor told me were cluster headaches, or
Hmm.
cluster migraines also around the time that this all started. And I haven't had one of those since. So I was having not just headaches, but like really severe clusters and migraines for several months. That hasn't happened in quite a, like since I started the metformin. And I was using an estradiol, the estrogen suppository, because during the month, I would have like really severe pain and like vaginal dryness. And
Hmm.
that was terrible. That's actually when all this kind of first
Right.
started, even
I
before I like
remember.
came to
Yeah.
you being like,
Yeah.
sex hurts so bad. I'm in tears. Like, what is happening to me? And so I was doing that several times a month. I actually experimented recently and stopped doing that altogether. I'm totally fine. I don't need
I,
it.
I'm, yeah, I was going to actually ask you about all this. So I'm really happy you brought it up.
Yeah.
Because when all that started and you were coming to the office and we were giving you the cream to use or suppository, or I can't remember which one it was, but
It's a suppository. Yeah.
I was thinking, oh my God, she's just way too young to be having these problems, you know? And I was
Hmm.
upset. Like, why would you be having these problems? And I still don't understand that with the metformin, how it helps with,
Well, because you're now in a reproductive cycle. You're getting peaks of estrogen in the first half of a 28-day cycle, you're getting peaks of progesterone in the second half, and that's what you need to make the pelvis work
so really she's
appropriately.
just very ripe and like
She's right.
functioning.
She's right.
You're ripe and ready.
Yeah.
So basically,
So
yeah.
she's
So
fertile myrtle.
right.
Yeah.
So your hormones are they're doing the correct job instead of the incorrect job where you would then get vaginal dryness. But yeah, I'm so glad that's better. That must be so great.
It's
Well,
so relieving. Yeah, that was
yeah.
so uncomfortable, and it always started after I was able to really start tracking. It was always like right before and then during my period. There was like this buildup of discomfort or pain if I didn't use the
Yeah.
suppositories and manage it. And yeah, I kind of started to taper off, and then I don't think I've used it in like 6 weeks at this point,
So,
and I haven't needed
so
to. I've had 2 periods.
is it fair to say that this is the plan that you're on until you're ready to get pregnant?
Yeah,
Okay.
And
yeah. For me,
then
this is
let's
working.
let's go to the next step, because when Riley is ready to get pregnant, what does she do?
Hmm.
Really, she should then see a reproductive specialist, an endocrinologist,
Okay.
just to do some baseline studies right away, because you don't want to waste time and you don't want to just have discomfort and not be ovulating regularly. So that's the time where things will just be reassessed. And
But does she go off
not,
metformin?
not initially. I mean, I would do testing, hormone testing, ovarian reserve testing, because the ovaries are still now working.
Yeah.
And
But like,
so,
if people are trying to conceive, do they have to go off metformin? That's my question.
no,
Okay.
no.
So she could stay on metformin even pregnant?
Yeah.
Oh, wow.
And then I don't know if this is an appropriate time to bring up another aspect of this that we've been talking about recently, and that is physiological HRT.
Yeah, I mentioned that to Riley and she was interested, but then I thought, she's doing so well. I don't know if I
We'll leave this one alone now. Okay.
But I like the idea of it.
I think it's perfect for people with PCOS.
And maybe explain to Riley, because all I did was ask her the question, like, would you be interested in this? But she is doing really well on just the metformin.
Yeah. So there's an argument that women are at their peak in many, many different arenas in their reproductive years. And why shouldn't we try to keep people in that state if their ovaries aren't working consistently to keep them there? And times of that would be either patients with PCOS or perimenopausal and menopausal patients that are not producing hormones at all and on some sort of static hormone replacement therapy. I said a moment ago that the two things that are basically used for PCOS right now are either the birth control pill, which suppresses ovarian function but at least straightens out the periods. The other choice being the metformin. This is a third choice because theoretically, we could give patients estrogen and progesterone mimicking a normal cycle. In other words, changing the doses of estrogen every few days during a 28-day cycle, progesterone for the second half of the cycle in a varying amount also. And that amount of hormone should cut down or cut off pituitary gland stimulations of the patient's own ovaries. And therefore, they wouldn't get pregnant because they wouldn't be ovulating. But the patient feels like they're ovulating and feels like the hormones are going exactly the way that they're supposed to do, as you do now. So when you're ready for my next experiment with you, Riley, we'll do it.
Wait, how is this administered?
It's a cream.
It's a cream. Yeah.
Yeah.
Oh,
Yeah.
and so it's a cream you put on where on your body?
You can put it on inner thigh, inner arms, abdomen. It's twice a day. It's estrogen throughout a 28-day cycle, and it's progesterone from days 14 to 28. And what will happen with these levels of hormones that we're getting in a patient, they would have a period, and then you start again on the first day. You start the lower dose of estrogen and gradually build up. So we're mimicking this, and this was first described by an anthropologist called T.S. Wiley, who wrote a book, Sex, Lies, and Menopause, and she was actually on our podcast about a year ago, I think. She's brilliant. It didn't work for everybody, and I think recently we've discovered why it didn't work, and the levels of hormones needed to be adjusted a bit. And now it's much more tolerable for patients, and they feel great on it. It's one of the choices, not often used, but should be frequently used for hormone replacement therapy in postmenopausal women, or in patients with PCOS, or in patients who are perimenopausal, where their ovaries are let's say, working some of the time and not all of the time. They're irregular. So, and these are, the creams are plant-based, bioidentical estrogen and progesterone.
Yeah.
And so you're saying that they mimic a cycle, but you don't actually ovulate. So
Correct.
your chances of pregnancy are low on them.
Yes.
Right, but
That's where
I
we're
wouldn't
going to
want to.
experiment with
I
you.
wouldn't want to roll the dice there because I know you're very busy right now. So, I mean, just looking at PCOS, or I mean, Riley's now in her 20s. She's, going to be having kids. What happens after you have kids with PCOS?
It's back to square one again, really.
Okay.
I mean, other than the fact that we know what's been going on. So
Okay.
again, it could be this physiological HRT that I've just talked about, or it could be metformin again. And there's been nothing wrong with using metformin at that time.
Right.
And metformin is also, and the main use of metformin is in control of type 2 diabetes and preventing the hemoglobin A1C going up because it lowers the blood levels of glucose. That's still a problem,
Yeah.
even after somebody has had all the kids they ever want to have.
Right.
Mm-hmm.
I know I still am so confused about your hypoglycemia and all this
Well,
because
I understand exactly what you're saying,
yes.
and I can't answer that either, except that the glucose tolerance test, which is where we were basing that diagnosis of hypoglycemia, is a not a really good physiological test. It's putting so much stress on the insulin blood sugar system.
Are you still wearing the glucose monitor?
I was going to bring that up.
Riley?
I don't have
No.
one right now. No.
Okay. But when you were wearing that, where did you fall a lot? What were your numbers?
I was namely in like between 70 and 90.
Right. And that's what happens to me. And then when I would eat something, it would go up to maybe like 110, 115 at the most. And
Same.
then dip.
It was
dip
never
back.
much higher than that, and not for
Right.
long.
Yeah. Then it would dip back down but I know you were getting, because you shared yours with me, and you were getting some alerts like in the middle of the night and things
Yeah,
like
sorry.
that.
So you were also getting alerts in the middle of the night?
Yeah, and me too.
Yeah, up together. Yeah, I would get alerts often in the middle of the night. And interestingly, I never felt any severe symptoms, or like it wasn't something
Yeah.
I think I would have really noticed if I wasn't getting the alert about it. But
Yeah.
multiple times I was like in the 50 zone,
Yeah.
and it would alert me to that.
And it
Same.
really didn't matter if that was happening because your own system was taking care of it. We've got to remember that with the continuous glucose monitor, that is really basically for people with diabetes or at least glucose metabolism abnormalities. So they put that alarm on there so people don't die from it. And but it's not, it's really maybe a little overuse for people with PCOS because they're not going to get that high.
Yeah.
And the alarms are going to keep them up because you can't stop the alarms on some of them. Some of them. So.
I think I gave you got that from me, your whole.
I think so too.
So Riley, I mean, looking back at your teens and everything, how you were feeling and how you're feeling now, what do you think needs to shift or change, like in awareness of PCOS out there in the world?
I think there's a lot of tolerance for symptoms on birth control. And I think that's like for me where I wish there was a stronger line. Like I when Duncan explained to me what PCOS was, which also, I mean, that's a place to start. I didn't even know what
Mhm.
that was. But outside of that general awareness, when I heard all of the symptoms of PCOS, I had many of them. And when I actually spoke to another doctor about it, she said just by looking at me and the fact that I'm not overweight, it's not something she would have like thought of right away. So I guess there's that, like that I don't know how many people fall into my category, but it seemed, and everything I read seemed like there's a lot of information for people who were struggling with their weight. And I certainly had that too, but not in a like very visually obvious way. And so I think there's needs to be more conversation about that, the people that are not maybe obviously presenting with this. And then also, yeah, the aspect of being on birth control and having symptoms like irregular periods and all, bleeding throughout the month and things like that that just aren't actually normal. But I very much just thought, okay, I guess this is like the price to pay for
Yeah.
being on the pill and even the arm implant. And I mean, I've had several different kinds of birth control. I've always struggled with those things. And I just thought and was told via Google and doctors and friends that like, oh, that's just part of it. And ultimately, when I heard all the symptoms of PCOS, I was like, oh no, I've actually had something going on this whole time. Birth control was masking some of it, but ultimately over time, my body eventually was rejecting that too, and it had to come out.
Yeah, what's interesting is everything I've read since dealing with this with you is the pill is the number one thing that people throw at PCOS, when in reality, this has been the number one thing that has made you sicker.
Right. Yep.
Yeah. And coming
Yeah.
off the pill and starting metformin.
Yeah. Multiple
Ha,
different pills, and all
yeah.
of them have made me feel worse.
Yeah. And women say that a lot. And I think it's something to consider. And I think that getting the right information out there, or getting some information out there, or this story is really important because things present in so many different ways for different people. There's
Mm-hmm.
never one story. So,
I agree.
yeah.
So thanks, Riley. Thanks for having this problem.
Yeah. And
And so we
yeah.
could talk about
It came easy.
it.
No,
Yeah.
thank you guys. I really appreciate being on this journey with you and everything you've done for me.
Yeah, I'm so glad you're feeling better, and we'll have more to report on this as we go with different things you're doing when you're ready to have kids. And right?
Yeah.
That'll be
One
interesting.
question I have, I know that will be interesting. You know, is it sort of an understanding that patients with PCOS have irregular ovulation, and that's why you're recommending that when it's time to get pregnant, kind of seeking out support right away
Yes,
is important?
that's
Okay.
right.
Yeah, and I think I remember what Dr. Dan said, who's our infertility doc friend. He said that having PCOS is like you have this huge boulder, and it it takes a big push to get it moving, but once it gets moving, you can't stop it. So
Mm,
he was feeling like you may need something like Clomid to get you to ovulate. And then you're going to have to look at, well, you don't want multiple pregnancies. Like, you know what I mean?
yeah.
So I think that was what he pointed out about you.
Okay.
So
Like
that's why I think,
the hyper fertility combined with the
Right.
irregular ovulation presents an interesting situation.
right, like you may need
Yeah.
help ovulating, but then you may have to look at how many eggs are popping through so
Yeah.
you don't have multiple births,
Yeah.
Okay.
right?
Yeah, but I think, the most likely thing is just when you really feel like you're getting ready to or you're about to try to get pregnant, then, doing some baseline studies right there and then and going for it. and see what happens. Well, while you're still on the metformin. And if you don't like that idea of the metformin, then you could stop that, and it's going to make it more difficult. The metformin is probably going to make that easier.
Yeah.
That remains to be seen.
Yeah, that'll be the next phase.
We'll be following along.
Right.
You certainly will. I'll need you.
Yeah. Yeah. Well, I'm just happy you're feeling better. I was so concerned because I know you so well and I know you don't complain. So for you to be saying it, I knew it had to be even worse than I knew. You know?
Yeah.
So
It got a little scary there for a minute, but I'm better.
that's good.
That's really good news. Excellent.
Yeah. Thank you.
Okay. Is there anything else we want to go over today about PCOS?
No, I think we've covered it well.
Yeah. But I think just to go over just quickly your main symptoms, bullet points.
My main symptoms were irregular periods, heavy bleeding, constant and intense headaches, a lot of anxiety, increased anxiety from my normal baseline anxious stuff. A really general feeling of being out of control emotionally. My mood swings were severe and intense. I was feeling rage and deep sadness and just really all over the map in a way that felt quite unlike me, and breaking out on my chest, acne on my back, and
vaginal dryness.
Vaginal dryness and low libido, vaginal pain and discomfort throughout the month.
And how is your weight now? We didn't talk about that. Not that you had a weight problem, but what's happened since metformin?
Since metformin, I actually gained a few pounds, more than a few. I think I gained 7 pounds when I started metformin. I lost a couple of them, and now it seems like I just balanced out.
Okay.
It's been several months now. But in December, when I started metformin, I gained 7 pounds, and then I've lost maybe 3 to 4 of those since. And I haven't gained or lost weight significantly in the last 3 months.
Okay. That's interesting.
Mm-hmm.
She's a good patient. She didn't call the office freaked out.
I did not. I was
Well, it was
disappointed.
also-
I was like, I thought I was going to lose weight on metformin. What's going on here? But
Well, it was the holiday season. Can we blame
it was the
that?
holiday season. I thought that too. I was like, maybe this, I feel like when you're on the journey I've been on, that's the least of my problems. I'm just like, whatever. I feel better. And my weight was fluctuating so much between off the pill, on the pill, off the pill, on NuvaRing, and then off NuvaRing on metformin. So I was kind of playing around with 10 pounds for the last 6 months. I had to get my wedding dress resized multiple times because my boobs were changing size. And I would go there, and a month later she'd be like, "What happened?" And she'd have to take it in and then take it out. It was the weirdest thing. So I had a lot of weight ups and downs, but never anything more than 10 pounds.
Okay.
So yes, I was not stoked in December when there was 7 pounds, but yeah, but it was Christmas, so I don't know.
Yeah. And it's cold and you can wear sweaters and
yeah, I know. I was like, maybe it was user error. I'm not going to call them and freak out. This could be a me thing.
That's funny. Okay. Well, Riley, thank you so much. I'm so glad you're doing well, and we're going to chat again about this.
Good.
Okay.
Appreciate you guys.
Yeah.
Bye.
Love you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.